Hello, my name is Kelsey Odom, and I am enrolled in the EDLE 5620 course. I am here to present to you guys a presentation on what special education is, as well as what 504 is, and how they differentiate and the aspects of what each program does. So I know what you're probably thinking. What is special education? What is a 504 plan? Is there a difference between the two? So yes, there is. They're both done by different laws, as well as they have different people who serve the programs. They have different qualifications for students who need to be in the programs. They have different modifications, accommodations, and a bunch of other stuff that goes along with that. So during this presentation, I'm going to dive in and explain to you guys what the difference of those both are and how kids qualify as either an IDEA or a 504. Let's start with special education. What is special education? The term that I felt most easy to understand is a school must offer an IEP, which is an individualized education program, which I'll go to a little further into detail here in a second, that is reasonably calculated to enable a children or child to make progress appropriate in the light of the child's circumstances. So, what does that mean? What is an IEP? An IEP is a written document that is developed for each individual kid that has accommodations, modifications, and services that will help give that kid a equal opportunity to learn in the general education or special education environment. Let's talk about the qualifications for the IDEA. The IDEA stands for Individuals with Disability Educational Act. And in order to get qualified for IDEA, there are 13 categories that provide access to special educations. However, these categories don't necessarily determine the supports and services that you receive when you are in the program. So the 13 categories are autism, deaf and blindness, deafness, emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, speech or language impairment, traumatic brain injury, or visual impairment, including blindness. There is 6 principles, and those are zero reject, appropriate evaluation, least restrictive environment, individual education, parent participation, as well as procedural safeguards. About SPED, you hear all of these words that just kind of get thrown around, and some people have a really hard time understanding what they mean, what the acronyms stand for, and all of that stuff that goes along with it. So in this collage of words, I've kind of just put different words that you'll probably hear commonly when you're around children with special needs, or you're talking with special education administrators or SDI teachers, or anyone in that department specifically. You'll hear a lot of these words commonly. So some examples are an ARD meeting, parent-child developmental modifications, study skills, social skills, functional behavioral assessment, emotional disturbance, progress reports, speech impairment, math deficiency, direct services and indirect services, assistive technology, calculators, and there's a ton of others that you'll hear. It's okay to ask, hey, I'm really confused about what this word means. Could you help explain it to me in a way that I can understand? So let's start with the process of how you become eligible in the IDEA, or in most cases, the special education is a little more known as. So what starts it out is an RTI, and what an RTI is, it's normally done from a general education teacher. They're just conducting and collecting data that prove that that student is eligible or qualifies for the special education program. After that's done, you go through the explanation of procedural safeguards. This is the prior. This is also prior to the notice of assessment, or it could be on the same day. Once that's done, you have to send out a notice of assessment to the parents or guardians. In order to conduct that, you must get approval from them first. Once you receive that consent, you may go on to go ahead and give that assessment to the child to see where they're falling, either grade level, behind grade level, if they have any deficiencies, and all of that fun stuff. Once that is done, sometimes a comprehensive assessment is needed. If that is needed, that takes place immediately after. After all of that's done, you conduct a notice of an IEP that just breaks down all of the services and the modifications, the minutes, the goals, what the student you feel after the assessments qualifies for, as well as anything additional that will help that student succeed. After you receive the confirmation from the parents that they've gotten the notice of the IEP, the IEP meeting takes place. Most of the time that's also called an ARD meeting, and there's initial ARDs for those new students that have never been into the special education program. Once that takes place, you go through the meeting. If the parents agree or the guardians agree, you go ahead and have them sign it, or they can take it home, think about it, and they have 5 days to send that back with any amendments that they have. If not, the IEP goes into place. Once that's done, it's the initiation of services. That's obviously like the different, if they're needing extra help in math and they have math deficiencies, you can give them minutes for math, where an SDI teacher will go in there and help them for however many minutes are provided, either daily or weekly, just based on what is provided in that IEP. Every 3 years, that IEP and ARD, and a 3-year reassessment takes place, and it just assesses the kid and makes sure that they're still where they were, or hopefully they've improved and have closed a little bit of the gap that they were struggling with. With all of that covered on special education, let's jump into the 504. Most of the time you'll hear it as called Section 504, and what Section 504 is a legislative attempt to ensure all students have the opportunity to receive a free and appropriate public education. You'll also see the acronym FAPE. That's meaning the same thing as the free and appropriate public education. This does include students with disabilities. One for Section 504. There's about 3 different bullet points that really go into detail regarding what all you have to be in the 504 section. So one is you have to have a physical or mental impairment which substantially limits one or more major life activities. You have to have a record of such an impairment and is regarded as having an impairment. There are some words that are similar to the words that you'll hear in the special education program. Some words differ from the Section 504. Some of the words you'll hear for 504 is record of disability, ADA, 504 plan, general education curriculum, Americans with Disabilities Act, physical impairments, mental impairments, modifications, accommodations, extra time, preferred seating, as well as the least restrictive environment. Let's talk about what is different between the two. For one, they both come from different laws, so 2 different laws apply to them. For the IEP, the Individuals with Disabilities Education Act, better known as the IDEA, goes along with the IEP. For the 504, the Section 504 of Rehabilitation Act of 1973 is what goes to that. What does it do? So the IEP provides individualized special education and related services to meet a child's unique needs. So these are going to differ based on each student, and they're really going to accommodate the student to help them succeed, not just in certain activities and different content areas, but also in life as well. The 504 plan, it provides services and changes to the learning environment to enable students to learn alongside their peers. Both of these services are at no cost to families. Who creates it? So although they have a lot of similarities, they also have a lot of different creators as far as who is sitting in the ARDs, who is creating the actual IEPs and document sheets for the 504s. So IEPs, it has to be a parent, guardian, or caregiver, one gen ed teacher, the special education teacher, a school psychologist, or other specialists who can interpret evaluation results, and then a district representative. At my school, we have our dietitian go ahead and conduct all of those ARD meetings, as well as sit in there and run them. For 504, the child's parent or caregiver must be there. A general and special education teachers, they help develop those, as well as the school's principal. Researching how to help people better understand the process of how you qualify for IDEA or Section 504, I found a really cool graph chart thing that it really breaks down how you classify someone as one or the other. So the first question for any student is, are they having difficulty in a classroom? If it is yes, which most of the time it will be yes if you are seeing if they qualify for one or the other, you would then ask, you need to notify the parents about proposed evaluation and obtain written consent. Without this, you can't do anything. The parents have to consent to you administering assessments or looking further into the student. You have to administer tests in the child's native language, and then use of materials and assessment materials. When that is completed, then you can answer the question, does the child have a disability that is specified in the IDEA? If yes, you would go to your left and you would answer the question, does the impairment have an adverse effect on the child's educational performance? If the original question, does the child have a disability that is specified in IDEA, is no, then you would go to the right section, which is the question of, does the student have a mental or physical impairment that affects a major life function? After answering those questions accordingly, it'll direct you in a yes or no, and per that, it'll ask you to develop an IEP if it feels that it's necessary for that student, or develop a Section 504 plan if that's the case. If the assessment feels that the student does not need a IEP or a Section 504 plan, it'll also lead you in the direction to just maybe give them extra support as far as tutoring, but services aren't needed at that time. Looking at the curriculum interventions and or instructional approaches for the special education or IDEA and the Section 504 plan, a variety of different curriculum interventions come to mind. For one, being the RTI, which is what gets the process started as far as seeing if a student classifies and qualifies as a student with special needs who needs to be in the program, or they need to be in the Section 504 program. After that, another one that comes to mind is kids that have behavioral problems, and positive behavior intervention and supports is something that helps really pinpoint what the behavior is that they're experiencing, what's causing it, what is amping it up, what is a consequence of that, and how to avoid that behavior occurring. Functional behavior assessment is kind of within that same area. It's really just trying to pinpoint what is causing that behavior and how we can avoid it at all costs. The next thing is the direct assessment. So it's what helps us get a better understanding of where that child's at as far as the grade level, reading level, math level, and all of that fun stuff. And at our school, we use Gates McGinney. Some other things, instructional approaches that we use here is SDI support. That can be direct support or in-class support, just depending on what's documented in their IEPs. And then the interventions and instructional approaches is also that small group setting as well as modeling, so the kids are really getting visuals on what they're trying to learn. Monitoring for these programs, you have to make sure there's checkpoints within the time that you have that student to ensure that they're progressing. And if they're not, maybe go back and look at their IEPs and see if you need to have a brief ARD or a brief meeting for 504s to see what you can put in place to help that child succeed. So with that being said, monitor what monitoring looks like in these programs is, for one, data collection, and that's so you can see the progression or decline that student is portraying. There's ARD meetings for the IDEA or 504 meetings for Section 504. Administration is also reviewing their progress throughout the year to ensure, one, that we are collecting data in order to continue making sure that student is on the best track to achieving their minutes, or not their minutes, their goals by the end of the year, as close as possible, if not way exceeding them. And then there's a mid-year review to monitor progress, and that is done with one-on-ones between the special ed teacher with an administrator as one of their appraisers. For the special education program at a middle school level throughout the past 3 years, there has been mistakes that I've noticed from general education teachers, as well as just anyone who really works at the middle school level. And putting something in place to help avoid that is something that I feel very strongly about, because no child deserves to be placed in a category that they don't necessarily belong to. And if they do belong to it, giving them the necessary accommodations and modifications or services to help them surpass that and succeed. So one common mistake that I did notice was, at times, teachers sometimes mislabel students as possibly having a learning disability because they don't understand the qualifications. This goes back to the RTI process. During that time, teachers sometimes think because students aren't completing work, or they are taking a long time to process thoughts, they qualify for the special education program, and that's not always the scenario. So how to avoid this is to stay up to date with the qualifications through each program. Really knowing what those qualifications are to get into the special education program will really help you in classifying what you think may or may not be a special educational student, or a student that needs to be in the special educational program. The other thing is to collect data. You can never have enough data, especially if you're going through that RTI process. Data is going to be your best friend. And then have conferences with other teachers that student may have to see if they're experiencing or noticing some of the same experiences that you are with that child. The other common mistake I see is some teachers don't feel that the accommodations and modifications listed in that child's IEP that they receive are necessary. For legal purposes, teachers have to give the accommodations and modifications that are listed within the IEP. Regardless of how they feel, data has to be taken to prove the student qualifies for the accommodations and modifications listed in the IEP, and it obviously has been taken if it's stated in that IEP, or it wouldn't have been approved. I hope you guys learned a lot during this short presentation. If you guys have questions, please email me at any time. My email is Kelsey Odom 3724@yahoo.com. I look forward to speaking with you guys, answering questions, and help broadening your knowledge about the special education program and the Section 504.